Record today's session. All right, so I'll just give a welcome. And this is our first Anchor Cohort webinar of 2024. So good to see you all here. We're really excited to be having this one, and we're going to be setting up the next phase of the cohort programming and introducing you to an exciting new collaborator and coach. Dr. Zaina Kayat is with us today, so I'll introduce her in a moment. Before we do that, though, I'm going to run through just a quick recap of where we're at with the programming. We're going to revisit the Nourish Clover for a couple of minutes. That's our guide through the journey of the Anchor Cohort. I'll be passing it to Zaina to run today's workshop, and we'll hear from her about some experiences and helpful lenses for understanding innovation in healthcare. And we'll have a little bit of time for discussion and a couple exercises in that workshop. And then we'll wrap just with a recap of next steps for working with Zaina and also for the Anchor Cohort overall, kind of moving ahead, looking ahead to the next 6 months or so. Does that sound okay as a plan? Did anybody have any questions or things that they wanted to raise before we get started? Feel free to throw it in the chat if you do. Okay, if not, we will keep moving. Okay, so this should probably be feeling familiar to you by now. It's our Nourish Clover, our awareness-based, ecologically inspired model for the Anchor Cohort. And it has a process here that kind of embeds lots of different systems change frameworks, but also provides a bit of a map for 4 distinct phases of work in our 2 years together. So we've aligned it to seasonal transitions as a metaphor for the type of work that we're doing in each phase or loop of the Clover image. And back in September, when we launched this Anchor Cohort, we began with our focus on the first loop, which is sensing at the bottom. So we asked you to meet as a team when you got back from Saskatoon, to engage wider stakeholders in your local health systems and communities, bringing them into the process of understanding your problem space and defining your problem, to then direct your work kind of going forward in the cohort. So we had a few workshops in the fall. The first one was to narrow in on that problem definition. So you all have problem statements now for your teams. And then the second one was to introduce you to tracking food-related GHG emissions using the Cool Food Pledge. You might remember we created a unique online collaboration space for each team in Miro. So you all have your own respective boards. That's where you can house any resources and brainstorming work that you do as a team. And it's also where we'll put in any slide decks or recordings or references to the cohort stuff. So the recording from today will go in there. We'll also have the slide decks from today. And I'll paste those links into our chat again a little bit later. But if you do want to be using that space, it's for you. And so maybe you want to bookmark those links for the future. And really, you can kind of make that messy and customize it. It's really for you to be using as you want. And if you need a bit of a tutorial, just let me know, and I'm happy to do that for your team. But that's a bit of an aside. So the idea for the past few months is that you've been laying the groundwork to set up your project work in the cohort in 2024. You've been engaging folks, you've been validating your understanding of your problem spaces and getting ready to start implementing some of the system interventions that you've identified already. And another key part of the sensing and servicing phases was using your inspiration grants from Nourish to stretch your thinking. And so there's a bunch of really exciting activities that have already happened there. And I know about all of them, but I felt like it might be nice just to share a couple because you might not know what each other has done. So some teams attended a farm to institution conference in the US and visited the mayor's office in New York City, as well as some leading hospitals on plant forward menus in New York. There have been a few local events in partnership with Indigenous community leaders working at the forefront of food security and food sovereignty. There have been some other local events where you're convening your wider team across a large geographic area. And so you've brought in some inspiring keynote speakers to spark ideas and new directions, or you have plans to do that over the coming weeks. There's been some internal sessions with your health organizations that you've hosted to kind of look at your overall picture and what you want to do together, and lots of other things too. And it's been really wonderful for us at Nourish to be hearing about what is getting you excited in the work, and about all the ideas you've got for those future directions. So we've kind of at this point moved through our sensing and surfacing phases, and now we're getting ready to move into the shaping phase. So this is really about kind of shifting into action and starting to try things out with the work that you're going to do in your local health systems and communities. So today's workshop and the next few months are designed to help you with that process. So we've brought in our special guest to support you on that journey. And Zaina's here with us now, but I'm going to just outline the process and what this is going to look like with Zaina, and then we're going to host today's workshop, and then we'll come back to this as well if you have any questions, just to make sure that it's all feeling good and clear. So our goal by the end of March is for each team to have a set of place-based health system interventions identified and ready to test, and that these will naturally align with Nourish's Food for Health levers. And I think all of you are familiar with those already. They're available on our website, and there are a bunch of interconnected, it's like a web of interconnected circles and different ways that you can influence food and health systems. So the process will look like this. Today's webinar will kick things off, and Zaina is going to share some conceptual frameworks to guide our thinking. And then over the months of February and March, each team will have 2 one-hour coaching sessions with Zaina one-to-one, where you can dive into your own questions, your own contexts, and the place-based work that you want to do so that you can start shaping it together. And Zaina is there as a guide and coach to help you do that and ask some helpful questions and challenges to get you to a place of true innovation in your systems. And then also most likely in March, there will be an opportunity to collaborate with some other teams in the cohort on some cross-cohort national project. So those projects will emerge probably through the initial coaching calls with your individual teams. Zaina's going to be listening for synergies and opportunities and overlap where there might be alignment between the interests that you have and the work that you want to do. So once you've done those place-based calls, we'll also set up some other calls with Zaina that focus on the national collaboration piece. So those will be with different configurations and mixes of teams, and we'll determine what that looks like as the process plays out a little bit more. Then in April, we're going to have another cross-cohort webinar like this, where everybody joins, and that will be an opportunity to share where each of your teams have gotten to. And again, Zaina will be here to help offer some insights and suggestions based on her work that she's been doing with you over the past couple of months. So that will set us up for you to be doing kind of active implementation work, trying things out in your systems through the summer and fall. And we'll also be offering some additional grant funds to support the national collaborative project. So we've already given you the one set of grants that helped for your inspiration phase and the sensing and surfacing part of the program. And then we'll be offering some additional grants in the spring that will help you with that national collaborative piece. So stay tuned for that. And I hope you enjoy the next couple of months, because it's a very generative time. And I think it's going to be really exciting and also rewarding as you start to see the ideas that you have taking shape and come to life. Okay, so with that, I am going to introduce Zaina now. So Dr. Zaina Kayat has over 20 years of experience with healthcare innovation, and I think the coolest title I've heard in a long time, which is Health Futurist. She worked with the Rotman School of Management at the University of Toronto, and she instructs a course on healthcare innovation in the Health MBA program there. She's also a growth advisor at Teladoc Health in Canada and the in-house futurist with Deloitte Canada's healthcare practice. So she completed her PhD in diabetes research from the University of Toronto and followed that with a career in strategy consulting. She's been with the Boston Consulting Group and currently resides in Toronto. So I'm going to pass it to you now, Zaina, and we're really excited for the time together.
All right. Hello, everyone. I feel like we're so one way. So maybe just so I know a little bit of who's all here, I don't know, like kind of what city are you in, or what room of your house are you in if you're somewhere? Just who are you? What org are you with? And where are you? Including if you want to acknowledge original lands that we're settling on. Throw that in the chat if you can. Okay. So name or org, at least your org, and where are you? Hello, Madison in London. Rachel's in London. Okay. BC. Hello, Elaine. London, Brantford. All right, I was just in Newfoundland a couple weeks ago. I don't know if you saw my talk I gave there. Okay. Nations, Toronto, Providence. All right, well, hello. I'm in Toronto today. All right, Goose Bay, love it. St. Anthony. Okay. All right. Well, there's going to be no shortage of frameworks. You know, some people might call them competing frameworks for how to do this type of work. So just don't get overwhelmed. I think, you know, the methods and the frameworks, they're abundant. They're everywhere. Some are bespoke or targeted to your area. Some are generic. I teach a lot of this stuff. They're really meant to just help you unpack like in a pretty messy, complex problem statement or challenge or opportunity, just to give you ways to think about it differently. So just don't get overwhelmed. Use what you can from them, but if what you already have works, it doesn't matter. So that's a little bit of what I'm going to do today. Robin, just to check, did you already share with people my material for today, or is that going to come shortly, or how's that going to work?
So each team's project lead has a copy of the slide deck. Okay. And your slides are also in each team's Miro board. So I can paste the links to the Miro board in the chat now, and then everyone should be able to go and access it. Yeah, and it's for later, just in case. There's just a couple things people are going to need to reference, but we might not even do that exercise. I'll just kind of go with the flow. So I've got, you know, some stuff to talk about. A couple of exercises for us to do. So we're interactive. So be ready to be on chat, and we're going to use Jamboard. I don't know if you guys use that. It's like a very simpler version of Miro for the purpose of today. But if you kind of want to get into something and like there's energy, just get off mute and chat, or put it in the chat, and I'll keep my eye on it. Robin, I'll ask you also to take a look if there's anything happening. And we'll just go with, you know, I'm here to help you. I've just got some things ready to talk about if we go there. Okay. So just kind of, you heard in my bio, my context, I mean, I'm a converted scientist, and I think I got my savvy on, or at least I figured out my, you know, I always call it my MTP, my massive transformational purpose, like kind of what do I want to do when I grow up? Probably at the time I was at Boston Consulting, because my job was basically solving messy, complex, hairy, almost intractable problems. Most of them were in the business environment, but some were, like sometimes my client was an entire country in Africa trying to figure out how to, whatever, close poverty or you name it. So that's where I kind of got that bug. And then because I just happened to study science and medicine, you know, I applied it to healthcare problems. So that's a bit of my why of this. And, you know, if I have to summarize my why, you know, as a futurist, like my job is to help anyone, organizations, health systems, patients, clinicians, understand, you know, what the future of health and care is looking like. That's everything kind of on the right side of this page. And we've 150 years of pretty much one model on the left side of the page. So emancipating from that and undoing that to go to the right, which is what I call innovation. You know, you can imagine how many forces are just want to hang on to the left. And so, you know, I really have a strong thesis, which is this bold statement in the middle, that anything we're doing, and this is in my sector of more healthcare, to kind of make the left side of the page, the status quo, better, which is what I call like quality improvement, incremental innovation, you know, and it's you know, all the resources are still spent on optimizing pretty much the current model. I actually think that's putting our entire ability to maintain a working healthcare system that's equitable and accessible, it's putting it at massive risk. So that's kind of my purpose. And so, you know, this is not a small undertaking. And so through different career pivots and places I've kind of been collecting methods, tools, what works, what doesn't, of how to support, facilitate, accelerate, if you will, the shift to the right side of this page at like the nano level, like let's say, you know, in one care pathway, the micro level in an organization, the meso level, kind of interagency or inter-org, and of course the macro level of the system. So kind of how I got on that
was sent at this place called Mars. I'll talk about it later, kind of Canada at the time, Canada's global address for innovation. I led their health platform. Then I did a year in the Netherlands, and that was really helpful for me because they really do approach healthcare innovation as a system and upstream health driver thing. They don't work on like making like a hospital work better. They're working on stopping people from ever going to the hospital in the first place. So in that context, I co-founded basically a school, kind of like what you're doing, but for the whole country on health innovation, and that's still going. Then I came back to Canada and I got to lead the futures team with a home and seniors care organization that's national and nonprofit. So that I got to kind of apply these methods now to a population of older adults. And I co-authored a book called The Future of Aging. And then I kind of said, okay, I got to go see what it's like to work in tech because nothing we do to protect our systems of the future, whether that's our food system, health, education, nothing will work at scale if it's not underpinned by a digital tech backbone. And so I've been with Teladoc Health now. I'm just an advisor. I was a leader there. And then just a year ago, Deloitte tapped me on the shoulder to come be their in-house health futurist to do kind of what I'm doing with you, but for all of their clients across Canada, which has been such a ride. And then I work with some nonprofits. And then only to say in the Netherlands, where we started our health innovation school, which is now spread to like the whole country. They do 6 cohorts a year, paid for by the government. And then it's also been spread to Belgium. They then launched another school called the Health Transformation School. And then they rebranded it the Health Transformation Community. But it's really more like exactly what your anchor cohort is at Nourish, which is it's not about doing health innovation in the healthcare system and teaching people at scale to do it, but they want to transform the health of the country of the Netherlands. And some of it involves food and some of it involves, poverty reduction and education and transportation. So anyway, so those are kind of some of the pedigree. Okay, so why is it so timely that Nourish, has been running these cohorts and that you're learning these skills, is we've had about 250 years of kind of the development of the world has been anchored in what we call the industrial economy, which was about, figuring out how to build cones of expertise and at industrial scale kind of, creating, value, if you will, whether that's industrializing education, industrializing agriculture, as you know, industrializing healthcare, because we didn't have a way to, at a cost that's acceptable to society, get things to people. Okay, so and that kind of got us to the next base. Then the last 15 years has been the digital economy or the internet economy or the information age, the knowledge economy. And now we're at a point where we have data about everything. The next era of our humanity is the solution economy. And my favorite kind of book about this was actually written by, at the time he was at Deloitte, Eggers and colleagues. But, the new way to, get things done that the world needs doing, isn't just industrializing things so there's standards and quality and, it's easy to move and get things to people. It's not just extracting the value of information in a way that's democratized. That's what the internet did, and now AI. It's this quote at the bottom, right? The most intractable problems left to solve need all this playing of all these different types of players and entities and, public, private, nonprofit, parapublic, and new methodologies. Like this whole economy, all the tools for it, the capacity, the training is what you're doing. You're at the edge of it, is kind of where we're at. Now, I'm sure you're doing, and Robin, correct me if I'm wrong, some type of methodology of human-centered design, or, how do you go from a problem, have a hypothesis, test it, et cetera, like what, kind of your four-leaf clover. And the traditional way we've done this is we say, oh yeah, to do really messy problem solving, which is what I call innovation, you need to be at the the sweet spot of, what we call desirability, viability, and feasibility. And just to give it to less kind of consultancy language, desirability is everything about the ultimate benefactor or user or people impacted by whatever you're trying to make better, because we are humans living in the world. So can we create some new value that the status quo isn't hitting the marks because we want to change that. So that's your hard work of what are you going to design and for who and how's it going to work and blah, blah, blah. As you figure that out, then you need to figure out feasibility. Can we actually deliver that value? So in theory, there's an opportunity. We've done all the research and all the user insights, but can it be executed, right? Is it operationally feasible? Capabilities, technology, is it legal? Whatever. And then you're trying to then optimize for viability, which is like economically, can we deliver this sustainably without kind of keeping to ask for, let's say, grants or things like that? Does it have a value generation that, can keep going? So all of us who do innovation, you don't do one, then the other, then the other. You're just kind of constantly cycling through these. So that's just kind of one thing of the journey, I'm sure you're aware, but just be really prepared for that. You're almost in many cycles of prototype, test, learn of all three of these at the same time. I would suggest at the front end of your work, like in these next few months, you're doing more red stuff and a little bit of orange. As you confirm there's really a problem solution fit, then you start to have to bring in the blue stuff. Like, how is this going to actually be funded or paid for or whatever and scaled? And then by the time you get to the end of your journey, you're doing a lot less red because you've confirmed this thing is worth doing. And now you're figuring out how to get it to scale. I'm just going to stop there and just see if there's any kind of questions or comments about this kind of orientation to the solution economy. We good? Okay, Robin, if you see something, just cut me off, okay? Because I only have one screen, so I'm trying to see everything here. Okay, so that's kind of the methodology. Well, depending on where you were trained, how you were brought up, what kind of schooling you did, and what kind of exposure to problem solving you've had in your pedigree to date, and what the collective of your team has had, and the collective of this whole cohort has had, you all know, if you're a hammer, everything's a nail, right? Like that's our default. We go after problems using the skills we know best, and they tend to work for us. And so generally, if you're from the world of design and kind of innovation and human-centered design and, labs and all this, your tool, for confirming there's a desirable new thing for people is more human-centered design, ethnography and interviews and understanding the user and, what's going to get in the way and blah, blah, blah. If you're like my pedigree in my former life, a business strategist where we sat at a computer and we predicted the world from an Excel model, you're doing the blue stuff. You're about the money. And is there a revenue? And is there cost? And is there a business case? What's the ROI? How's it going to work? So it's kind of the numbers side of viability. And does the organization have access? And then if you're a tech startup, or you're used to doing operations, or you're used to doing quality improvement, you've got your methods. You're like, no, a tech will fix this, or we're going to do a QI process, PDSA, whatever. And the reality is actually you need all the methods. And that's really hard to ask humans who work in a complex system to be kind of good at all of this at the same time. This is this new kind of composite skill set and competency that is required of us who want to make change in complex, messy systems. And that's what this kind of training is really important for. And just be aware of your biases. And that's why, you can only solve these things first as a team and then as a network. That's why I love the idea of national projects, because everyone's going to bring something that you're going to need kind of all the time. Okay. A new layer in the last 2 years, and you guys are way ahead of the curve, has been added to this kind of framework of how do you do innovation, and it cuts kind of across all of it, and you can pick a word. I think you guys said ecologically responsible, but it's not just desirability, feasibility, and viability, but it's like responsibility. Like it's actually not just about us humans. And what we're starting to see is just as much attention as anyone who wants to solve for, usually a problem of humans, that's the red, whether, in my word of healthcare, like we want to get health outcomes to a certain place, or we want to stop diabetes incidence, or we want to make cancer detected earlier, whatever we're trying to solve for. We're obsessed about ourselves as humans, right? We're still human-centered, actually is now kind of a bad word. So it's really this idea of life-centered innovation. And then all the considerations, of course, you've got it built in of eco, but of equity denied groups, of inclusiveness, of diversity, like pick your list. But so this is now another layer of problem solving competence we're adding to the expectation of those of us who work in healthcare, and a lot of you are, say, in hospitals, and they got to learn this stuff, kind of some other methods, because this isn't being taught in the normal industrial model of education, where you're learned to be great at whatever, nursing, finance, supply chain, etc. Okay, I'm just going to stop there, and then I'm going to get into some tips. Like, any questions, any comments, any reactions? Is this resonating for people?
Don't be shy, folks. I know it's sometimes intimidating when there's a big group of faces on the webinar, but feel free to speak up. It's good to hear how people are thinking about some of this.
Maybe while you're reflecting, just maybe Robin or the group, are you incorporating human-centered design, like actual training and the methodology in the program?
It's kind of one of the backgrounds that informed our Clover and the kind of overall design approach, but we're not doing explicit training on it.
Okay, yeah, and you'd need more or less of it depending on what kind of, what your substrate for the problem is. So. Okay, so in that context, I'm just going to go through, these are kind of my 6 tips. We'll see how far we get. I'm going to spend a lot of time on number 1 and number 6, and a little bit in between of just some quick things. This word innovation gets thrown around so much. I actually hate the word. I teach a course called Healthcare Innovation, and it's just like, because particularly in Canada, where we have a massive tolerance for mediocrity, status quo is so dominant. We have a lot of what I call oligopolies. Like, we have 5 banks. We have, 3 telcos. We have only a few major players in healthcare, government dominant. So there's really no burning platform for anybody to continually renew and be better, because there's kind of no other choice for us Canadians in anything, to be honest. And so, when anyone does anything that just seems kind of curious or different, we call it all innovation, right? Well, that's not. There's a true definition of innovation. I can't get into it, but here's the way I see it is, in the whatever problem spaces you're trying to solve for, or opportunity, it's not always a problem, whether that's, again, in the walls of your organization or the boundaries, what you're calling place-based, or something a bit more systemic. There's the current state, whatever it is, and you want to get it to a much better state of impact, or whatever you want it to be. And innovation is that lift to that new state. It leaps you up. And in my view, it is not worth the effort of everything you're doing and the methodologies that you're going to honor that I just showed you to do this work, because it is not easy and it fails like 99% of the time. If you're not going for like a 5x lift, 5x could be cheaper. 5x could be 5x better experience. 5x could be better outcomes, better scale. I don't know what, 5x. And the key thing to understand is, my best metaphor is like the iPhone 1 versus now the iPhone 15. Like, if today I tried to tell you, oh, here's an iPhone 1, it's going to be great, you'd be like, what? This is like, no. But that was a leap from, remember, old school BlackBerry? So it gets you what I call your worst, best place. That first iteration, the first rollout, the first whatever prototype, it's in theory 5x, but after that, it needs so much work to then get the real value. That's where improvement comes in, continuous, blah, blah, blah. So that's kind of how I distinguish. And I just want to push you to go for the bananas, like monkeys do. Another way I like to teach this or explain it for those of us who work in the health and care system, because we know improvement so well, there's so much to improve, right? You know, and all quality improvement in a healthcare context is there's a standard of care based on evidence of what should happen, based on a lot of great evidence. And, you know, we fund based on the standard of care, but, you know, a hospital or a health system or a doctor office is about 30 to 40% delivering below standard of care on pretty much everything in Canadian healthcare. And so, of course, we need quality improvement to do all the blue stuff, do the things right, do the right things, do them better, get rid of low value add work. And again, that is really, really hard. Like using improvement methodologies, you know, at best could get you like a 30% lift. And that's amazing, right? Because we're stuck at this kind of 70% effectiveness. As you move to the bottom, and this is PISEC's framework, to me, now you're in innovation territory. Now, in the true definition of innovation in any sector, it's like only number 6 and 7. So you're really innovating when it's so new that no one's ever done it before, or they tell you it can't be done, right? Like colonizing Mars, let's say. I would submit in healthcare, because Canada is like 10 or 15 years behind on most things that are now standard of care in other countries, you know, we will pass Zaina's test of innovation if we start to do some of like number 5. If we could just replicate a little bit of what's already been proven and scaled in other places, we will really make a 5x impact, but we didn't have to invent it from scratch. And I encourage you, go for number 5 most of the time. I really don't think we need the energy to completely come up with something new to Canada or new to the world to solve for the kind of things you're trying to solve for. It's kind of been done in some way, and it's more, how are you going to adjust it to make it work for this context? Okay, I'm just going to give one other way of getting at the 5x, and you know, just show of hands, have you guys done the 3 horizons framework? Has that been, that's everyone? Yeah.
Some teams have, Zaina, and some teams haven't. We use that framework in our last cohort, so we have a couple teams that were in both, but not everybody will be familiar with it necessarily.
So this 3 horizons framework has been hacked and to death. Like everyone's hacked it their way, including me. This is my version. There's the 3 boxes by Govindrathan. There's McKinsey's version. You know, in the context of doing complex system level innovation in healthcare, when I was the futurist, which was a fancy word for chief innovation officer in a large nonprofit seniors care organization, charity, our entire framework for my team was, you know, this was our framework to make sure the work we do stays in the northeast corner of the 3 horizons. So the way I framed it, to kind of make sure we're not wasting our time internally improving the organization, because we could do that with a 1,000 person team and we'd never be done. Let's be clear. We were a 118-year-old healthcare organization that behaved like it, like paper charting still, okay? So sure, we could optimize the business, but that's never gonna get us the impact that we wanted to deliver as mission. So I often say, for me, you know, on the horizontal axis is how much are you changing the, you know, what I call the business model, like what you're doing, what you're offering, and most importantly, how you're getting paid. You could just change the payment model of a service, and that will put you all the way to the right in health and care and public goods in Canada, because we have such a dominant fee-for-service model without actually changing the value proposition. No new offering, no new, just change how you pay, and that will unlock a whole new set of value. But anyway, so that's kind of one. And then vertically for my organization, because we are a large, complex national org, for us to get you up the vertical axis is how much are we introducing an entirely new capability to the org or to the whole system that didn't exist before. So I'll just give you an example. One of the projects, initiatives we worked on that kind of put us all the way to the top, but nothing to the right. We didn't change any offering. We didn't change anything we gave patients or our staff. Was, we called it people obsessed. We wanted to re-engineer our whole company to be obsessed about our staff, like so obsessed, and basically blow up every HR orthodoxy that ever exists. No managers, no hierarchy, no credentialing, like just stuff that like a HR person would be like, that can't be done. Remember my litmus test earlier? We're like, oh, it can't be that we're doing, so that's kind of the vertical. And I often say, is it new to your org, is the middle, or new to Canada, or new to your region or province, or is it new to the world, which is rare for Canada? So, okay, so I'm going to suggest you want to be either at the boundary of Horizon 2 and 3, or squarely in 3, or kind of upper edge of 2. That's where you're going to find the 5X. That's where you're going to unlock new value that we cannot unlock using the way we do it today of every silo does their own thing and using core methodologies or current things. And just so you understand how Horizon 2 differs from Horizon 3, I'm going to explain it 2 ways. If you set out and you kind of, you decide on your grid, something that is so new to, Canada or the world in terms of an offering, and on the vertical, it's a whole new capability of the org, you're clearly in Horizon 3. Well, when you're doing that, you're more what, in the innovation world, we would call like a skunk works organization. You're like a lab, completely separate from the entity you're part of. So if you're part of a hospital or a regional health authority, like it's there doing its thing, you're out here creating a completely new thing on its own, like a greenhouse kind of thing. Like, like if you wanted to introduce a new plant species into an old growth forest, you're not just going to go plant it in that old forest. It's going to die. There's no light, no nutrition. The big, huge trees are dominating the ecosystem. Okay. But if you do it in a little greenhouse and you control the conditions and then this is the arrow in, you introduce it into your system. That's how you get scale. Okay. So that's one complete pathway. But if you're landing in Horizon 2, and I think you can still find 5X, your starting point isn't completely new. You're not out there. You're in your org, but you're taking the assets of your whatever, your health org, your system, your region, your whatever, and you're evolving them. You're hacking them to unlock something new. Your origin point is very different. Okay, so really clear to understand what's your starting point for your problem space you're trying to solve for, because your strategies, everything you're going to learn in this cohort, are completely different if you're starting more Horizon 3 versus initiating at Horizon 2. Okay, I'm just going to stop there and see if that's landing. Questions or comments? Does anyone know if like your working hypothesis, and you don't know until you don't know a problem, obviously, until you start solving it, but anyone know if they think they're in Horizon 3 zone or Horizon 2? Can you put it in the chat or unmute? You can pitch it to me and I can tell you if I think you're right. Anyone? Okay, well, keep thinking. I'm gonna explain what I just explained a different way. Oh yeah, sorry. Let me show you what it looks like in reality. So when I was at SE Health, St. Elizabeth Healthcare, we already, by bringing me in as their futurist, we already reinvented our organization. So it was a 118-year-old. It was a Catholic charity. It was called St. Elizabeth Order of Visiting Nurses. And pretty much we were getting government contracts to do home care. That was the business for a very long time. And we could keep doing that, and that's nice, but we're not going to hit mission. So we rebranded our brand. We went to SE Health to kind of not have the word saint in our language because of everything going on in Canada with the Catholic Church. We took the word healthcare. We're like, no, we're in the business of health, not care. We're not about the service. We're about the result. And we re-architected our corporate structure from being a nonprofit charity to a social enterprise. And there's a whole explicitness of being a social enterprise. Social enterprise means we make profit from the activities we do, but any of our proceeds, we invest in our big social causes we're trying to solve. And for us, that was First Nations health and homelessness. So we're a profit-making machine, but nobody's sharing the dividends of those profits. We're using that money to solve big externalities that, government and public sector can't solve. So in my framework, this is when I ran the shop, just to show you, first of all, we had 4 or 5 other innovation teams in the corporation. we had a digital transformation office. We had a research team that was designing new care models and testing them and scaling them. And they were very much an applied research unit. We were spending $10 million a year, again, from our proceeds, our profit on our research institute. We had a clinical innovation team. But my team, I said, no, I'm not solving anything for the 118-year-old home care business government. Our futures team is hanging out in Horizon 3 and Horizon 2, and that needs very different methods. And we were absolutely focused on, only working on projects for a couple of areas we wanted to move the dial in Canada on around aging and seniors. Whereas like I would get my boss or whatever, the business kind of be, oh, can you work on this thing for pediatrics or cancer? I'm like, no, that's not what we do. Sorry, it's not going to get done. We're absolutely focused on our areas. And so if you map, we had a portfolio of projects, and I would suggest for Nourish, whatever you guys work on is really a portfolio, right? And somewhere in, in our area, somewhere in the purple stuff, somewhere in the blue, somewhere in the red, somewhere on the line of 2 versus 3, somewhere way the hell out there in Horizon 3. But that's kind of, what we were doing. And, we were basically a professional shop of testing out new business models and new capabilities without diluting our effort on everyday stuff of the core, which again, I could have had a massive team just doing that, but it's not going to get us anywhere. Okay. So that's kind of what it looks like in practice. Usually you need a portfolio, you need 5, 6, 10 things, because only one of these will work. Only one, maybe 2, if you're very, very, very lucky. So it's good that you've got a mix. And why 8 out of 10 won't work? It could be that, you designed it right, you tested it, but the test in the market doesn't work. It's not. But it could be because regulations aren't ready. It could be because the market's just not ready. You're too early, or it could be because you actually designed it wrong. It could be any of those. So oftentimes, just because you have a portfolio, you needed all this work for 6 months and it doesn't test right, doesn't mean it's done. It's just maybe you have to park it for a couple of years until something else happens in the market, and then it's ready. And that's basically what happened with COVID. A lot of things were already there. They were nascent. They were just stuck. And then this massive crisis happened and boom, flowers bloomed. Okay, I just want to explain Horizon 1, 2, 3 in another way. So imagine you're in your organization, whatever it is, and like I said, I think 99% of resources hang out in Horizon 1. Improvement, incremental innovation, whatever you want to call it, which is again very, very important. But the methodology for that is, come up with a new thing, work it out, and implement it pretty much, because it's not that complex to implement. I mean, it's hard, but you can do it. And that's where all the energy and momentum is. Horizon, but when organizations keep doing that, which is probably to me what led to the genesis of Nourish, it's like the more you keep making today better, you just keep getting increasing failure. Like it just doesn't work. It doesn't fit. People don't want to work on that because they know it's kind of a path to, very minimal returns. At the same time in Horizon 3, you're like, there's some weak signals now. There's some signs something's in the water supply, or like, I'm looking at Africa or Australia or wherever, and like they're going in this direction. I'm starting to see we might be on that path. So as a percent of time of, let's call it an org or a system, working on Horizon 3 type projects is like 5% of your time or 10%, right? Maybe it could be 100% of your time, but as a composite, most is making today better. But your methodology is like, you got to have a vision for the future. You have to have a very good narrative of how this all might play out. How do you want it to play out in the future? And you're anchoring on that vision. And then you're not developing and implementing, you're running a bunch of experiments. Like you don't know, but you have a methodology for that, right? And then when those experiments land, then you embody this new future, right? That's Horizon 3 innovation. And like I said, that's kind of exclusively what my team was doing. And if that's not hard enough, I just told you need a portfolio. Now there's Horizon 2. Horizon 2 is like a hybrid, but it's a completely different methodology too. So Horizon 2, you're saying there's some emerging change. It's not a weak signal. Like It's here. Like every nurse wants to quit their job. Our healthcare system has no more money, and 25% of Canadians do not have a doctor in Newfoundland. Like, this is not a weak signal. This is right here, and it's not going to get better. And we know we're never going to solve it using the red stuff. We're not Horizon 1. So you're doing Horizon 2 innovation because you're evolving from what you do today, but you need a very different model, payment model, whatever. And that's more a methodology of I'd say, human-centered design. Research, get data, get a prototype, prove it works, and then figure out how you're going to insert it into the old status quo to disrupt it and take away and then the old goes away, okay? So this is a little scary if I was you, because I've just showed you 3 parallel tracks. And the reason why system change feels so hard right now, particularly in health and care and climate, is like we're in this zone of disruption in the middle where the old is trying to go away and new is coming in, and there's just a lot of parallel stuff going on, and that is very hard to manage. It's way easier to wake up every day and just do what you're supposed to do every day and thank you very much and go home, and that's just not going to help. So anyway, I know that's now it got all messy, so I don't want to show you all the other things, but this is kind of conceptually the curve. Any kind of comments or questions? Can anyone relate? Have you seen this somewhere else?
Someone be brave. Come on. I know you're thinking things.
So I'll just say, again, if you follow these curves, on the right, and it's kind of at the bottom, is like where we want.
Dana,
Yeah, I'll come to you, Donna, in a sec. Yeah. Unmute, Donna. You want to get to the right. We want to have what we call a radically different, whatever system, whatever you want to call it. But you can't just get that, right? You have to go through this messy in the bit. But kind of that second tranche on the bottom left, where it says new ideas fit better, that's kind of a sign that you're on the right track, right? Like you're trying these new things in your place-based, which I think is probably going to be on the yellow curve, or your kind of, and like, there's some signs it's working. That's like, keep going, keep going, right? Versus trying to just go back to the status quo and make it better, because the status quo is going away. We know that. Donna.
Hi, I just wanted to say, looking at this graph, I was just thinking about our facility, and a lot of times we're just in one, we're stuck there, and we might develop something new, but then we can't really get to that disruption point.
Yep.
Those new ideas, and then
that's why you're in this cohort, Donna.
Yes, exactly. So I feel like we've been in one for a long time, and then even for 3 for the future, in terms of methodology for experimenting, like I don't even think we even think about that. Like, what do we do to get there?
Yeah,
like that's something that we don't talk about or we think about.
No, I know, but it's changing, right? Like I would say, particularly those of you who work in like a healthcare delivery, which I saw some of your, or a system. Yeah, the dominant infrastructure to kind of make things always better has been quality improvement, process improvement, great initiatives, little projects, grants, blah, blah, research. More and more complex health systems, orgs, regions are building a unit, a lab, or like what I was, the futures team, to literally own the methodology for Horizon 2 and 3. Right there, and that role, call it a chief transformation officer, whatever you want to call it, is at least at the executive table just as important as your chief clinical or your chief finance, or whatever, or your quality person. And in some organizations, like really leading, I've never seen it in health, really, there's 2 CEOs. There's the chief executive officer, whose job is all red and a little bit of yellow, because doing that alone is very hard. You guys see how much we're suffering today. Like, it's very hard just to keep up with the needs of today and to deliver your obligations to whatever your stakeholders are. But Pierre is the chief entrepreneurial officer, unencumbered by today. Their job is to build the green and the yellow, and they report to the board equal. That's the dream. Okay, that's what I wanted in my last org, why I left actually. I was like, I don't want to report to CEO, I need to be peered, because our industry is in such a mess. It should all go away. Everything we've been doing for 118 years should sunset, just like newspapers and print. They don't do that very much, and they're the red line, you know? So anyway, but no one wants to listen to me because I'm cuckoo. Okay, so another kind of technique, I just want to check the time. I'm not going to do this one. Actually, we'll do one. We'll have a little bit of fun because I need you guys to engage. Okay, so I don't know if you guys are going to learn, or any of show of hands, have you done strategic foresight methods-ish? So again, as a futurist, this is how I work. So those of you who work, I know hospitals, you know, they do this thing called the strategic plan. They predict to like 6 decimal points for the next 3 years, everything that's going to happen, and they put the numbers, and that's all taking today. That's Horizon 1 and going forward, right? Even if there's big new initiatives, it's still, they all say the same thing. Like if you gave me 20 healthcare system strategic plans and took the label off the name, they all look the same. Quality, excellence, people, blah, blah, blah. Foresight is the new method, again, is becoming a competency that complex health and other public good systems are building. This is what I do at Deloitte, is it's saying, no, I'm gonna go out and fan out all the possible futures that could evolve in about 10 years-ish. And you could do very specific scenarios of the future, like you could write a story of whatever, there's a whole methodology, but a simple one I use when I'm doing workshops is we make 4 scenarios. A growth scenario, so things get a little bit better, kind of the good things continue. Collapse, all the bad continues to kind of nothing. Discipline is like, it is collapsing, but we do a lot of things to steer the ship. Okay, not easy to do a discipline scenario. And then a transformation scenario says we actually rebase, you know, our ways of being, our ways of doing, we actually reinvent ourselves. And what does that look like in 10 years if those 4? So we play it out, and then I have a guiding way. And I did this for 4 days with like, this was a gig I did for like the Pope of the world, because Catholic healthcare, and some of you are at Unity, is in big trouble, right? Like most public funded things are going to demand to be secular. It's losing a lot of credibility. You don't really need the nuns to run healthcare anymore. Like Catholic healthcare used to be like 80% of all healthcare in Canada. It's like 30% now, because back then nobody would take care of sick people. So mission was for Catholic to do this, but now what's the next mission of Catholic healthcare? So we went through and we created these 4 scenarios, and just the act of getting people in a room and writing out a story of these 4 was enough to get everybody aligned on action. It was pretty amazing. So it's a nice little methodology. So we're gonna just do a very, very quick one. You guys seem pretty good with tech and Miro. So see if you can take a picture of this QR code. I am gonna put it in the chat too. And just let me know if you have any problem getting into Jamboard. Let me just get the Jamboard here. Can you guys get in there? Is that working okay? I just put it in the chat as well.
Didn't let me into the Jamboard through the QR code. It says we need access.
Okay, give me 1 sec. Let me just do a different share. Rookie mistake. I think I didn't do the right option. Just give me one. Oh, it's restricted. Sorry. Okay, I'll just put a new in the chat. Try that one.
That works? Yep.
Okay, we're gonna do a 5-minute version of like a normal strategic foresight using something you know. Okay, and I'm just gonna show you. Okay, so what we do in foresight is we start on the left and we have a very clear shared understanding of what the current state is, good and bad and whatever. And then in this case, we're gonna just do two scenarios. One is a transformation scenario. It's like everything amazing plays out, and the bottom is a collapse scenario. So what you're gonna do, you guys know how to use Jamboard at the top here. You just use your arrow and you can go from page to page up here. Oops. up here. And so we're gonna play around with something we all know. So first, just gonna put your name. You just click on the sticky note, put your name. So claim a space, a red or an orange. We'll come to that in a sec. Okay, the bottom left is about your current dwelling situation. You know, is it an apartment, a house? Are you with roommates? Is it where you live? So you know, just put 4 things that come top of mind about how you live today. So for me, I'd be like one bathroom, 3 teenagers. God help me try to get, you know, ready in the morning. Subway under my house. Loud, and crime. Our car gets broken into all the time. But I love that I'm near Bloor Street and I never drive anywhere. I do all my shopping every day. I don't have a Costco membership. And I don't like that there's no nature, lots of concrete. That's mine, okay? Maybe for you, it's like, I have annoying roommates, or I want to own, but I rent, or there's asbestos, or, you know, I'm on the ocean. I don't know. It doesn't matter. You know, and then play around for a couple minutes and write out 4 transformations. If everything you could dream of in 10 years of the optimal way you're living, a place, the building, the city, put that out, dream. And on the bottom, do the collapse scenario. In 10 years, what would be the exact antithesis of anything you would ever want to happen? And maybe that's the path you're on right now, because you're maybe 25 years old and you have no savings, but yet you want to own a house, but you have no path because interest rates are 9%. Like, I have no idea, you know? Okay, so can we just play around with that? Everyone just go ahead, pick a page that doesn't have a name on it. So there's 2 per page. Put your name and just start to imagine, and let's see where everyone's at, and then we'll come back, okay? So take a couple
There's one
minutes.
more step, Sana. I think we just have view only. Can you make it edit?
Oh my
only?
God, I'm so sorry. Geez, what is
Okay.
wrong with me? Such a
No
rookie. Oh, it does say viewer. Oh, okay.
Perfect.
I'm a little rusty at,
okay,
okay, there we go.
good. Okay, so everyone's just going to a page with no one's name on it yet and choosing either the pink or
Yeah,
the
put
orange.
your name first to claim it. You do the arrows at the top. And just go really fast. Like, there's no right or wrong. And if you don't want to put your actual name, just put a name. If you don't want people to know that you've got bed bugs, I don't know. You know, I don't care. It's more the practice of the power of foresight as a methodology to stretch your thinking. So what you're doing is, like, if you picked a pink sticker, stick to pink all the time. That's how we're doing 2 per page. Just because with Jamboard, I couldn't do 25 pages. That's why I had to do 2 per page. Let's see. Okay, people are starting to get their current state. Okay, some are doing the future state. Okay, so if you're not there, I mean, you don't have to fill out 4 of everything. Just put a couple things on there, like what would be a transformation experience for relative to today, top right? And what would be a complete collapse scenario in 10 years, bottom right, for your color? Let's give it another couple minutes.
This collapse scenario is stressing me out, Zaina.
Well, that's why it's good. This is what happened when I did it with the Catholic bishops. They were like, the collapse scenario, which is usually like really extreme, like, you know, infested with termites, whatever, was 100% around the corner. And until they did the exercise, they didn't really realize it. And then when we did the transform scenario, their energy, their heart, their spirit changed. And they're like, we can do this, guys. Like, you know what I mean? It was really powerful. And it's a very different approach than starting with, oh, Catholic healthcare is on the decline. How do we save it? Write a report, commission a study, hire a consulting firm, yada, yada, yada. Not going to get you there. That's horizon 1. Okay, I'm just gonna, you know, again, there's no right answer. This is just to practice, but this could be a technique that you use, you know, some version of it for your work, just to make sure you're really both stretching your thinking about the art of the possible and the goal you want to hit, the 5x. And you're very aware of how bad it could get if things continue the way they are, because that actually can get you to 5x too. Like stopping the worst from happening is also massive impact, right? That's what we're trying to do with climate change, reminder. So let me just, you know, pick one. Kaya, do you want to just share a little bit of your story? I know you got to transformation, but not collapse. What's going on? If you're okay with that?
Sure. So my house is really close to work, so it only takes me about 15 minutes to get to work. I can drive to anywhere in the city that I need to go. The only thing about, like, there's a couple things that I don't love about my space. Live in not a very family-friendly neighborhood. There's always some new characters around. Each day there's never a dull moment at home. We do have limited storage space in the home, I would say. But we have large windows, natural light. It's a really beautiful old home. And I know my landlords. It's great.
Great. Okay.
I would say within the next 10 years, I would love to have built my own home. I would love an outdoor cooking space, trails to walk, steps out of my front door, and to be able to be growing my own food.
Amazing, right? So great. And like, again, if we did a full foresight exercise, like what I did with the Catholic health, you know, our current state, we spent quite a bit of time getting all the facts on the table. You know, what's going on in the future of religion, what's going on in the future of healthcare, what's going on in the future of society, you know, government, like all the facts is the current state. And then we played out the scenarios. So good. Okay, good job, you guys. So hopefully that's a little tool you can do. Those are always fun to do. And you know, the next step we would have done would be, Kara, I would be like, okay, Kara, tell me 2 actions you could do today. That's what strategic foresight is. What's our strategic bet today to get you on a path of transformation? Or what's a action you could do today to stop you from going on the collapse path? That's how we translate foresight work into strategic planning for today. And you arrive at very different choices versus traditional strategic planning. Make sense? Okay, any questions about that? Okay, so I'm just teaching you some of my favorite methods. I got lots. Okay, we're just gonna keep going. How much time did you want, Robin? At the
If you
end?
take like another 15 to 20, and then
perfect.
I'll just take a few minutes at the end for a wrap up.
Okay, perfect. So I won't do the last exercise, but I'll show it to you and then you guys can use it. Another technique we use and is around what I call BHAGs. Anyone know what BHAG is? Do it in the chat or unmute. Yeah.
Big, hairy something.
Yeah, big, hairy, audacious goals. In other more kind of system change speak, we call these simple rules, which is basically like anchor everyone on a pretty ambitious, I mean, bigger than bold, right? Very aspirational number or goal or something that it'd be like, oh, we galvanize. That's net zero. That's, pre whatever year Earth temperature. In the sustainable development goals, that's, to me, the rest of them are not written very well, but number 1 and 2, no poverty. Pretty clear what we're trying to get to, or eradicate malaria, or zero hunger. Like there's a number, and it's like, oh, because when you do that as your target, as your future state, there's kind of no time to have a committee, to have a task force, to have a report, to do a study, to, to do the way we do things today, because like, no, we just said we want to hit this. I'll just give you one example. I mean, some of you might not have been even like born yet, but when Deb Matthews was our health minister in Ontario, we at the time, we were at a rate of something like 12 or 15%, maybe higher, children under 10 were obese. Children were getting type 2 diabetes in Ontario. I think it was at 15%. And she came in and they set a BHAG that said, we want to get that down in 5 years to 0%. Zero. And by the way, it had been 0% for our entire history as a species. Children don't get obesity, okay? So like when you do that as a policy, like you can't incremental your way to the answer. You need a very different approach, and I'll explain what it was. In the end, it didn't get followed through, which pissed me off, but that's the idea. So a BHAG that's simple, that's clear, that's big, it really galvanizes people. It gets them to think very differently. So that would be one I'd have, and that's kind of why I throw that number 5x at you. That's a BHAG. It really brings focus. I'll just give you some examples. Japan crossed the threshold of being the super aged. So in the world right now, we have 7 countries that are super aged, which has never happened in the history of our species, where 20% or more of the population is over 65. That's never happened. On average, we all died at about 18 years old for 99.9% of the time we've been on this earth. They crossed that threshold a long time ago. Canada will be there next year, just so you know. We'll be country number 11 in the world. So we're very fast. So they were not going to solve for an aging society using what we're trying to do in Canada, like more healthcare, more nursing homes. No. These are their BHAGs for 2040. Keep people in the labor force with good, employment opportunities, at least until the age of 70. We try to retire people at 55. Stretch life expectancy for 3 years. You know how hard it is to get 6 months of life expectancy extended for a population, and then drive productivity by more than 5%. So stuff like that, like when you set that as your BHAG, the initiatives you take, the levers you'll pull, the strategies you take, your permission to say no to a lot of terrible ideas or asks for funding is very clear. It's like, how's that going to help me do this? It's just like climate change, in my opinion, but you can do that for your problems. I love the Dutch. They set crazy BHAGs all the time, and political elected officials put them out there, and they will not get elected if they don't hit them, and so I use these all the time in Canada. So that's BHAGs. So I just wanted to kind of put a little quick one on that. Next one, and I think I heard already, Robin, you guys have a theory of change, and a theory sounds like very academic. It's not. It's just a methodology or a framework for solving a system issue. So I think your 4 Clover is a great one. So whether that's the one you're going to use specifically for your project, because it's kind of the framework for your program, just have one. They're not hard. There's a million of them. Does anyone know who this picture is? In the chat, do you guys know this guy? Machiavelli, right? So just keep in mind, this was what, 1400s was Machiavelli. So think, if I didn't tell you it was Machiavelli and it wasn't 1400s and you read this quote, you would think Zaina wrote this yesterday. So he knew, humans knew 600 years ago that there is nothing harder to do than to bring a new order. That's system change, okay? Because the innovator, that's you, who's trying to bust out the old and bring in the new, you're going to make enemies of everybody who's done very, very well and is very comfortable in the old. And the new, you're going to have what he called lukewarm defenders. Because it's so new, nobody even knows. They don't even can imagine. So how the hell are they going to defend it, right? So this is kind of what he knew we were up against with tackling kind of the intractable problems of society. And, you know, we've been working on fixing system problems for a long time. And again, we're now in the solution economy. The good news is there are great methods now. So in my world of health innovation, you know, I got to come up with my methods to bust through my big brick wall of all the things that are going to hang on to the past. And you can't do a point solution to get through this wall. You know, one new care pathway, hire more doctors, do a chronic disease management. No, that's not going to get through this. That's why we have so much pilots and so many initiatives and so many grants, because we do them as point solutions. So you need a theory of change. So when Deb Matthews, in that story I talked about, set out to get childhood obesity rates down to 0 from 20%, one of the ways they knew is like, we are not going to do this using old school policy methods and bureaucracy methods. So they co-funded a system innovation lab at Mars, because that was the kind of innovation arm of government, to take on this and a few other big system change problems. We recruited a top systems innovator from Netherlands, Jori van Stevenhoven. They already had a change lab like this in Netherlands, one of the first in the world. These are also called Gov Labs, if you haven't followed that whole literature. And, you know, our methodology at Mars, whether we're solving childhood obesity, we're working on climate, we're working on data liquidity in Ontario, you know, was that any project we did or initiative had 3 layers of innovation, actually. You had to innovate in orange horizontally on the solution layer, the new thing that you're changing, the new offering, the new policy, the new whatever. You had to work on the capacity layer, which is the end of the day, the new order is going to have humans involved. And how do you get them into the new, embodying the new way? That's got to have a step-by-step methodology, independent of the actual solution, the new way of doing things. And then usually when things are stuck in a system, a food system, a health system, an education system, it's because there are policies or regulations that no longer serve. And if you can unlock those, you'll open up the possibility that your solution layer does, and it'll allow your capacity to flow. And so we actually would go through your typical innovation methodology. What's your hypothesis? Do your research, test some solutions, and then go scale them to market, HRTM. But we would run it at the same time on all 3 layers at the same time. So just another way to think about it is, if you're not hitting all these things, the people, the actual solution, and usually policy that has to change, and that is hard to do. Like for some of the work some of my colleagues do in aging, like they're changing the retirement laws, the pension system, okay? Like that's what you got to do, and you got to figure out how you're going to do that. And there's no way you're going to do that from the 4 walls of your organization. So we call this our periodic table of system change, and we applied it for every single project that we did. And it's, of course, not linear. It's like you go here, then you go there, then you come back, then you go there, then you learn this, then you go, you know, it's a constant iteration. I'll just skip that. Another way of I adopted it when I did my work at St. Eliz, like one of my Horizon 3 projects was to blow up the entire model of how we do home-based care for seniors. In a way, like if you told somebody, be like, not possible, Zaina. I'm like, yeah, we're going for it. And it was 4 years of my life. It's finally being implemented. But I used the Matryoshka doll as my metaphor or my framework, that we were actually running 5 parallel innovation projects at the same time. We were innovating in the middle on people and their family. We were expecting patients to behave differently, to do things differently. We were innovating just on them. That could have been enough. That's classic Horizon 1. Change the care model for people. We are changing how our clinicians had to behave, mostly nurses, their workflows, how we hire them, how we fire them, how we pay them. So much innovation on that. That alone, earth-shattering change, but we were doing that. And we were changing our own our org structure, our language, everything in our org had to change to enable and unlock the ability to change how our practitioners work, to change how our patients experience care. And then, of course, this is not about us. We had to do inter-organizational innovation. So we had to change the boundaries of us and like 30 different players in the system that surround our patients and our clinicians. And then the only way this was going to stick, the only way it was going to scale, was we actually had to change government. We had to change policy. So that's kind of the scale of what is left to do to solve the hardest things, right? So I think I've made my point. Okay, just last couple quick ones. Just, you know this, and that was in my first quote about the solution economy. Again, the problems left to solve, no single entity can solve. So your default setting is, what I call blurred lines, like weird mashups, weird configurations. Partnerships is the word we use. Collaboration, it's so overused, but it's so true. And I get really excited if you get really weird, like really unusual suspects that you bring into your table, into your tent, because they have a capability or access that your existing ecosystem that kind of is the current way we do things doesn't, right? So laundromats being the place where care gets delivered. Why? Well, people who go to laundromats kind of match the populations that need the most help, that are the most equity denied. They're kind of sitting there doing nothing, so that's kind of, there's a whole new business model in that. Barbershops, same thing, the kind of people who need intervention, that traditional way we do things, like come to the white people in their white lab coats at our hospital, like they're not going to those places. We go to where they are and where they're comfortable and where they can get education and access from people they trust. And then, Uber did some crazy stuff with vaccination. And there's tons of this in the food space. This one was, Geisinger, a whole health system in Utah, literally prescribing food. And we talk about prescribing food as medicine, but they're actually doing it. And they're calculating ROI in real time. And therefore, the funding model is there because they can monetize it. They can quantify it. So they don't have to worry about changing policy or getting reimbursement or whatever. It all works because their results are amazing. And lots of cool examples. Kaiser, which is a huge health system in California, they're trying to tackle food security as a healthcare system, but they're like, we're not good at this. We're good at doing care. So what did they do? Instead of them doing a big initiative and having a cohort of Nourish, they're like, we're just going to give $16 million to a nonprofit that's actually going to deliver and close gaps in food security. So lots of cool partnerships and mashups, that get you the result you want, the 5X, without you having to keep it contained to the traditional players. So that's the kind of the lesson there. Last ones. This is one slide here. Is it just, I find when it comes time to find capital to finance the working capital for all that work to kind of develop and test and prototype and blah, 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 we use old school things, like we ask for grants or we try to find a donor or whatever. No, like there are so many new forms of capital to finance system change solutions like this. It's exploding, and I can do a separate session on that. We don't have time for that right now, but I just want you to keep that in mind, because remember I talked about, when you're solving a messy problem, there's desirability. So, does it actually solve a problem? There's viability. Can we deliver? feasibility, can we operationally execute? And then viability is kind of the payment, like the dollars, right? Is there a sustainable business model? And most things I see get stuck there. They're like, oh, there's no funding. Oh, government didn't give me money. I'm like, if you're asking government for money, stop your project. Stop. There's all new forms of capital to solve social problems. Okay, and then my last message is, and like a little bit of what you're doing here, but think about how do you build that into your project is mindset, hacking mindset. So, you know, in my innovation school in the Netherlands that I co-founded, and then the National Health Service in the UK, they have a similar, we modeled it off their School for Change Agents. This is an entire kind of factory to teach people literally how to change their brain chemistry to shed orthodoxy. Because if you can change mindset, kind of you can do everything else I just talked about. And a lot of why we're so stuck is orthodoxy, right? So another language for that word is mental model, paradigm, unwritten rules. Pick a word, but you know, if you think of your levers or where you can intervene on a complex system, sure, you can change a process or, you know, whatever, change data, make a new rule, but your teeter-totter goes really fast if you go on the far right. You change the core paradigm, then the rest happens, right? Gary Hamel did it a different way. It's all the same thing, right? But I call that smashing orthodoxy or shedding orthodoxy or flipping orthodoxy. And I'll just kind of end here. You know, if you think about what you're trying to do, you know, you're at the far left. There's lots going on, you know, with our food system, with health, with climate. You guys are on top of all that change, you know, in your own organizations, you know, your internal change and what they're trying to do and the world, blah, blah. You guys are going to get that. On the far right, your job to be done in the next 6 months is get on a credible path forward. And again, I'm going to suggest to 5x impact. And you're going to learn lots of methods. I just showed you a bunch to bridge those two, okay? And I'm saying one of the biggest ones is just a crisis of status quo thinking. If you can get through that first, you get a new kind of playing field, like this emergence of what I call new unwritten rules. Now you're going to have substrate on which to have much better possibilities. And then you got to do all your hard innovation work. So that's kind of the idea. And so I do a whole workshop, which we won't do, of orthodoxy flipping. And I'll just orient you to it and then we'll wrap up. Because what I do, and you can have all these slides, is I've got this inspiration gallery where I show all these other sectors that flip the orthodoxy. A bunch of them that you're like, it's been this way for 70 years. What if we did it this way? And then you use that as like inspiration cards. And you go, okay, what if we did number 5 and 7 and applied it to my problem? So that's kind of a fun little exercise, just like that forecasting one I just did with you with your house. This is just little techniques to get your group to open your mind and really call out your own biases and orthodoxies and get them on the altar to be altered. So, okay, I'm going to stop there. And just see if there's any kind of questions. Otherwise, you know, I think you're going to talk about it, Robin. You know, this is the QR code, which should work if you want to book some one-on-one time with me, but I think you're going to share that as well.
Yeah, I will for sure. Thanks, Zaina. That looks like it could be a cool exercise for maybe some of the coaching time that you've got with the teams as well. So folks can look that over ahead of time and then, yeah, dive right in with you. Okay, well, we don't have a lot of time, so I'm going to just share a couple of quick wrap-up things, and then we're going to let you go. But I imagine your heads are spinning a little bit. I hope they are. That was kind of our goal. We wanted to throw a lot of ideas at you. And Zaina, thank you so much for your energy. I feel just like as soon as you start talking, I'm like riveted and ready to go. I'm like, okay, that's it. We are going to change the world. So I really appreciate you bringing that today. And I'm just going to share my screen one more time quickly because there's a couple of next steps that I want to make sure feel clear. Okay, so can everyone see my screen there? Great. Okay, so the main thing is just the follow-up. So for the next couple of months, you're going to have a chance to dive into some of these methods and questions and pick Zaina's brain some more in a little bit more of an intimate space with your team. So she shared the QR codes, and also there's a link in Calendly that will take you to her booking. So I'm going to paste that into our chat now. And basically, oh, that's the same thing, right?
Yep.
So if everyone, maybe the project leads can just take on consulting with others on your team who would want to be part of these sessions before you book with Zaina, just to minimize some of the back and forth. But that is the main follow-up to do, is to get your 2 coaching sessions booked in with Zaina for your team. And after that, we'll probably have a few more sessions that are like more of the cross cohort stuff, where a few teams will come together around the national work, but we're going to hold off on booking those until we know what that work is actually starting to look like. So that will come a little bit later. So the focus now is just to book your team's 2 coaching sessions. And again, the goals that we talked about here, you're developing a portfolio, you're thinking about what are you going to try. You're going to use some of these methods. There's no specific prescribed method that Nourish is saying you have to do. There's no homework as an exercise, but we want you to think about these as options and see what resonates, see what makes sense, works for your context, works through the way that your group thinks. And try some stuff out and have fun with it and experiment, because this is really a generative phase where I think hopefully some of these methods will help push you to that Horizon 3 type thinking that gets us away from the crisis of the status quo, as Zaina was describing it. And we have another webinar booked in April, so I will send out an invitation for that, so everybody gets that in their calendar sooner rather than later. This is just to say kind of the food for health levers are another way for you to think about some of the options and opportunities for you there. But I would say some of these things are definitely still within Horizon 1 and kind of 2 activities. So it's not that they don't have value, but again, what we're trying to help you do is think towards that Horizon 3 level type of change. And then just a couple of things for the cohort overall. So the Food is Our Medicine learning circles are going to be starting up soon in a couple of weeks. I think 3 teams have sent their participant lists to Meyer, and we're still waiting on lists from 2 teams. You know who you are, but if you don't, reach out to me. So those start on February 14th. So you need to send whoever's going to be participating in those to Meyer so that she can get you hooked up with all of the registration links on Zoom. We have a project lead call happening on the 22nd. And several of you have done your cool food baseline already. Some of you are still working on it, but I think the goal for those teams that haven't submitted the baseline yet would be for end of February, and Amy is available to support you with that over the next month as you have questions. Coaching sessions I talked about, and then we're kind of moving towards having this portfolio of the work that you want to be doing over the next several months in place by the end of March. So that's what Zaina is going to be supporting you with through those coaching sessions. We're going to have some work that will be for your own team locally, and then we'll also have some national directions that we're excited to be identifying and pursuing together. That's pretty much it. I think if you have any questions, feel free to reach out to me, contact your project lead. They're also in the loop on these things. Our last slide has contact information for our team as well as Zaina. And I will be away just on a personal note in the month of February. So please reach out to Amy or Meyer in my absence, or directly to Zaina regarding your coaching sessions. But I'm really excited for you. I hope you have fun with the process. And I hope this was a stimulating webinar today, and lots of really good stuff to come. And thank you so much again, Zaina, for hosting the time today.
See you soon.
All right. Feel free to stay on if you have questions, but otherwise enjoy the rest of your day, everyone.